Hello, welcome to my channel. My name is Bridget. I'm a nurse practitioner and a nurse educator. In today's video, we will be going over 5 pharmacology NCLEX style questions courtesy of nursing.com. Nursing.com is an excellent resource if you are in nursing school. They have courses, cheat sheets, practice questions, study plans, SimClocks, have videos, and their courses and videos can guide you through nursing school so that you can consolidate studying and focus on what you really need to know. If you want to learn more about nursing.com, check out my affiliate link below. A new graduate nurse is being oriented to the unit and is learning the procedure for medication administration. Which of the following practices is appropriate to ensure that a high alert drug is given in the correct dosage? But I'm going to go with 2 nurses verify. So the reason why the other ones were not correct is because you should be checking for all medications. You check the chart for the order, you verify the dose on the medicine packaging, and you check the PDR. Now, for example, with insulin, we always had 2 nurses double check what we were giving because that is a high alert medication. The nurse is reviewing a client's medications from home and notes that levothyroxine is listed as a daily medication. The nurse knows at which of the following times is best to take this medication. So levothyroxine should be given in the morning on an empty stomach because food inhibits its absorption tremendously. Levothyroxine is best absorbed when taken on an empty stomach 1 hour to 30 minutes before breakfast is appropriate. And calcium, iron, and certain other drugs will decrease the absorption of levothyroxine. Levothyroxine is a thyroid medication for people that have hypothyroidism. The nurse is caring for a client who is a type 2 diabetic and allergic to sulfonylurea medications. Which of the following medications is suitable for this client? Glipizide, ide. Look at all these endings, ide. Metformin is not a sulfonylurea. So look at your endings, right? In pharmacology, your endings will give things away. So metformin is the only non-sulfonylurea medication listed for type 2 diabetes. I do have a course also on NCLEX-Test taking strategies. If you are struggling with test taking, make sure you check out my course. It's not an NCLEX review course. It just helps you on how to take tests. Ideally, this would be for the student that is just starting nursing school. That way you can learn how to take tests before you even get into nursing school. After behavioral therapy has failed to help a client stay focused long enough to complete their studies, the nurse knows that the next step is medication. Which of the following medications is an example of what the client might be prescribed? They are having trouble staying focused. This is a benzo, so no, that's not going to be it. So what we're thinking here, if someone has trouble staying focused, we need a medication for ADHD. This is a beta blocker. It's going to lower heart rate. This is misspelled, but this is also known as Reglan. So that helps slow down gastric emptying. So the correct answer is this one, methylphenidate. No rationales for this one, but like I said, it's the only one for ADHD. Thrombolytic therapy is used for which of the following conditions? Select all that apply. So lytic is to break something apart, right? And we need to break platelets. So what is a condition where platelets are clogging where we would need to break something apart? Is hemorrhagic correct? No, because they're already bleeding out. That would only make it worse. Ischemic is when blood flow is obstructed somewhere in the brain. So yes. Pulmonary embolism, yes. Acute coronary thrombosis, of course, we need to break down that clot. There's so many people with hypertension walking around. They're not all on thrombolytic therapy. That is not the intervention for that. Thrombolytic medications break up clots quickly. Acute coronary thrombosis, an example of where this drug would be used. So you can pause to read the rationales. If you have questions, you can always review the videos that nursing.com has to brush up on those specific topics. Thank you so much for watching. Make sure that you hit that like button and you smash that subscribe button. I currently have a goal of hitting 30,000 subscribers. I've been at this for 3 years and still haven't reached it. So it would mean a lot if you subscribed, and keep in mind that it doesn't cost you anything to subscribe and you can always unsubscribe later. Until next time.